Hi, my name is Dr. Drew DeMann, Director of Manhattan Medicine. I want to talk to you today about a new field called regenerative medicine, or something called orthobiologic therapies. These are fancy words for harnessing the body's own regenerative capabilities. And it's really exciting. It's my current specialty. I've sort of developed an interest in this starting back about 10 years ago. And it's the world of taking our own cells, our own healing capability, and amplifying them so we can recover from injuries that previously would require surgery or just chronic use of medication. So for instance, a rotator cuff injury or a tennis elbow that hasn't healed very well or not responded to physical therapy, we now have the ability to harvest cells from one part of our body, transplant them to the damaged tissue, and repair that tissue, all without the need for surgery. And I call it surgery by syringe. And what's kind of amazing about it, it can be done in the office, there's no downtime, and it's a very low risk procedure. So what does this mean? Well, there are certain cells in our body that are designed to repair tissue. Unfortunately, there are certain parts of our body that are very poor in blood supply, things like our rotator cuff or our low back discs, or things like our knee cartilage. And over time, as they start to break down and degenerate, the body doesn't really see the degenerative process or the breakdown, doesn't send cells to the area to repair it, and unfortunately the area just gets older and more degenerative over time, to the point that unfortunately sometimes we have to remove the entire joint, like a knee replacement, or do a big fusion surgery like in back pain, or just deal with the pain like chronic elbow pain in tennis elbow. So the world of regenerative medicine is exciting. For the first time now, we have the ability to take cells from one part of the body and transplant them to the area where they're needed under ultra-high accuracy with imaging. So what that means is we can get cells that are called stem cells from either your tummy fat, believe it or not, there are plenty there, and most people have no problem with us taking it from there, or your bone marrow. These are two places that stem cells hide. Now, what are stem cells? These are cells that can turn into any other tissue in the body or help that tissue repair itself. Well, unfortunately, these cells kind of hide in those areas and generally don't get the signal that these sort of issues are occurring. But what we can do is we can take a small amount of tummy fat, separate the stem cells from the tummy fat, or a small amount of bone marrow from an area around your hip, and take those cells and under ultra-high precision using an X-ray machine or an ultrasound device in real time and put those cells exactly where we need them. The result is the tissue can now heal, and the results have been outrageous. And I can say that because I've seen it. There are different success rates for different types of patients and different conditions. If we put everybody together, it's pretty impressive. I would say about 80% of our patients are at least 50% better, and many patients are far better than that, 100% returning to their normal activities. But there are lots of extenuating circumstances. But I would say on average, our patients do very, very well. And about 90% of our patients return to physical activities, probably within about 2 to 3 months following the procedure. We have patients who have had chronic back pain for years, and I hope you look at some of the patients that we've had results with. And these patients are often coming to our office failing multiple therapies. And after a single procedure in the office with essentially no downtime, they can often get back to their activity within a few weeks. So I hope you learn a little bit more about regenerative medicine, because I think it's a great way for you to get back to what you want to do with the least amount of risk in the shortest period of time.